I'm Jon Lentz with City and State, and I'm pleased to welcome everyone to today's panel discussion on long-term care in New York. This discussion is hosted by City and State in partnership with AARP New York, and it hits on a number of timely topics and issues being debated in Albany, where a state budget is due in weeks. We'll hear from state lawmakers about the latest efforts to improve oversight of nursing homes, maximize opportunities for home care, and other healthcare matters facing the aging in New York. We do only have 1 hour, so let's get going. I'll briefly introduce the panelists, and due to time constraints, I'll do without any extended introductions. I ask that each panelist try to keep responses to 2 minutes if possible, so everyone has a chance to answer a few questions. Our panelists today are State Senator Sue Serino, Assemblymember Sarah Clark, Assemblymember Catalina Cruz, Assemblymember Billy Jones, Assemblymember Ron Kim, Assemblymember Karines Reyes, and Assemblymember Al Ferris, as well as Bill Ferris, Assemblymember Al Taylor, sorry, I misspoke, lawmaker, and finally Bill Ferris, Senior Legislative Representative from AARP New York. Welcome, everyone. And let's jump in, starting out with the matter of nursing homes. As you all know, nursing home oversight became a huge issue early on during the coronavirus pandemic. In March of 2020, then Governor Andrew Cuomo quietly inserted a measure in the state budget that protected nursing home operators and other healthcare facilities from being sued for alleged neglect. After an uproar, that measure was eventually overturned, but it did not allow for lawsuits to be filed retroactively. State Attorney General Letitia James also issued a bombshell report showing that a larger number of nursing home residents died from COVID-19 than public DOH data reflected. Ultimately, some 15,000 nursing home residents have died in New York. But let's look forward. What can be done now to better protect New Yorkers living in nursing homes? Can we bolster the state's long-term care ombudsman program? Can we create a victims compensation fund, overhaul nursing home ratings, any other legislative proposals directly related to nursing homes? We'll start with the state senator we have on the panel, Senator Serino, over to you.
Oh, good morning, and thank you so much to AARP and City and State for housing this forum. You know, I've been talking about the nursing home issues for a long time, along with our Assembly member, Ron Kim, and everything that happened through COVID. And I've been requesting for a look back, also a re-audit, so to speak, so we find out when we went wrong, where we went wrong, so we don't revisit this again. I think our ombudsmen are critical to helping with our residents that are in the nursing homes, because a lot of people that end up in the nursing homes don't have family members, so they really rely on those resources. And we really have to have fair pay for our healthcare workers too. It's just a shame that that they're treated like this. You know, when you talk about minimum wage, like we say, they can go out to flip a burger rather than doing this very critical and very hard work. But we need them, and we have to do anything that we can to incentivize them to want to have these jobs and make sure that they're compensated for them. You know, so they're not working 2 and 3 jobs like we hear now.
Sure. And a quick follow-up, that long-term care ombudsman program, I understand it's a federally mandated program. Every state has one. There's some critics say, you know, this is underfunded, understaffed. Governor Hochul, I believe, has said she will bolster it, but at this point, I believe her proposal is a study. Senator, any thoughts on that particular program, the governor's proposal, what you see should be done here?
Yeah, well, many of the people that are ombudsmen are a little older too, because they volunteer. So you know, there should be some way for them to have initiatives, incentives, whether it's compensated, because like I said, they are eyes on the people that are living in nursing homes, and we really depend on them. And I know that they put their heart and souls into that job.
Great, thank you, Senator. I will move on to the Assembly members, and again, we're going in alphabetical order by last name. We'll start with Assemblymember Clark. The broader issue of nursing homes, and specifically the long-term care ombudsman program, what, if anything, do you think should be done on that front?
Sure, I couldn't agree more on some of the oversights for what we need to do in the nursing homes. Thankful for both our Attorney General for doing that report, giving us that opportunity to really see what went wrong and what we need to do to move forward. And to my chair on the Aging Committee in the Assembly, Ron Kim, who is a tireless effort to not let this go on the back burner, right? Like we cannot let this go away. And so thankful that he does not and really makes sure that this continues to be something we focus on. As for the long-term care ombudsman program, near and dear to my heart, I, along with Senator May last year, made some legislative improvements to that program on the back end, mostly because a lot of those complaints that our ombudsmans were bringing to the DOH that were coming from families and residents were going unanswered. And definitely not getting resolved. So we, on the back end, put in some legislative fixes to make sure the DOH was a little more accountable to that program. It's not perfect yet. I think we need to go a little further. And we did see that the governor put in money there in DOH to help resolve some of the complaints. The issue now is exactly what you said. This is a mostly volunteer run program. We know, thanks to the AARP and thanks to you guys for hosting with city and state, but thanks to AARP and some of our advocates, we can really see how lacking we are in terms of the dollars we put into that program versus other states in the country. And therefore, we need to professionalize it. We need to bring in the staff. Best practices say that every long-term care facility should be visited once a week by an ombudsman. We are critically, I think last I saw 30% weren't even visited once. So we need to professionalize it. I, with Chair Kim, are advocating with Senator May for a $20 million ask in this year's budget in our one houses to really make that a professional office that's run by staff. And that's the only way we're ever going to achieve the quality and the needs we need to get out of it when we move forward. So that's our hope.
Great, thank you. Over to you, Assemblymember Catalina Cruz.
Good morning, John. I think, first of all, to our chairman, Ron Kim, who I agree with Sarah, has done a fantastic job at raising this issue in a way that we had not seen before. Unfortunately, it was as a result of the pandemic, but I'm not sure that under any other leadership, we would have had this level of noise on what's really happening, not only in our nursing homes, but in long-term care facilities, which is one of the bills that I work with as well with Senator May, who seems to bring us all together to really look in depth at what's happening with our long-term care facilities and how do we improve it in our state. We have the bill in place now. It's going to create a task force. I think I would wish that it could include more folks like the nurses and other folks who should have a voice at the table, but as it always happens with some of these bills, you have to compromise. But it doesn't mean that it's the last word. We're going to continue to push because I think that unfortunately, this is going to take us some time to fix. We didn't just get here overnight. These locations, the nursing homes, the long-term care facilities, the way in which we treat the care workers, this didn't happen overnight. So I want to reassure our New Yorkers that you have champions here who are going to continue to fight to make sure that our elder community, as well as those who need long-term care, are being looked after, that we're not going to just forget when some other piece of news comes out. This is going to be a priority for many of us for a long time. We want to make sure that people have dignity. There is a real possibility that what happened during COVID could happen again, that we're going to get another pandemic in a couple of years, a couple of decades. None of us want to be having this same conversation. And this long-term care task force is going to look at where did we go wrong in caring for our community, not only during COVID, but even before that, because again, this didn't just start overnight. And we want to make sure that we're addressing those issues, that we're including the voices that need to be heard, and that we are fixing this. And that means investment, that means additional legislation. And we're going to be here all along the way to make sure that it happens.
Great, thank you for those thoughts. Assemblymember Billy Jones, over to you.
Let me figure out the mute here. Yes, I couldn't agree with my colleagues more. The ombudsman program, we need to fund that. My area, I mean, I have one person covering a 3 or 4 county range. I mean, that's just ridiculous. We need more funding there. We need more staffing in that program. Also, I have to put, take my hat off to Chair Kim, who has done legislation to make sure that there is accountability there, not only on DOH, but nursing homes. But I'm in a little different situation than some other places in the state. I believe our nursing homes try the best that they can do, and the administrators try the best that they can do, but we need more support for them, more funding for staffing. It was brought up. We passed a safe staffing bill. We put a little bit of money towards it. We still haven't implemented it. Where are we on that? So we need to push for that. Push the governor to implement those standards in our nursing homes. Let's face it. Nobody grows up and says they want to be in a nursing home. Okay, I had an uncle years ago that said, listen, did you buy your nursing home insurance? I didn't even know what nursing home insurance was. But my point is, we have to plan more for this. Right now, of course, we have to do the steps to provide more staffing, to provide that ombudsman. Also, Harry Bronson had a bill, compassionate caregiver bill, that allowed family members to go in there for visitation during a state of emergency, that they could be in there as well, which is needed. But we have to provide more services. And my point about being prepared, and nobody grows up says they want to be in a nursing home, and I think they do great work there. We have to educate our residents now more than ever to be prepared for long-term care, to be prepared for years where we age. It's going to happen. We can fight it as long as we can, but we have to be prepared for that. But I do applaud my colleagues for all that they've done, those steps that they have taken, but we have to implement that legislation. And we do. Many of my colleagues are very, very well aware of this. The Ombudsman program, we're looking for more funding in that. We need to staff our ombudsmen so they can be in there with our loved ones and make sure that they're getting the care that they need in those facilities.
Great, thank you. And we'll get on to the question of home care as well momentarily, kind of a related question of what we do, where the elderly can be cared for. But over to you, Ron Kim, Assemblywoman Ron Kim. We've heard several of your colleagues already giving you credit for addressing this issue. Let's hear from you.
Thank you, John. Well, I want to thank my colleagues as well. I mean, from Sarah to Catalina for passing your legislation last couple of years, Al, Billy for joining us in our oversight hearings, and of course, Karines, Reyes for persistent advocating for nurses and hospitals, and the senator for sending with us last year with the families when no one was out there really being an advocate on the ground. Thank you for all your work. I think we need to be first and foremost be honest about our failures in our structure and in our system. I think we need to recognize that we knew that we were in a crisis. In fact, in 2014, the Department of Health received a grant, a federal grant, to prepare for such an emergency. That money was squandered away. We don't even know what happened with that money, with that grant. It went to a secondary nonprofit group called HRI, Health Research Institute, and there was no outcome of anything of that kind of a research. So I bring those points up because we knew that we had a crisis and we walked into this moment, and there has to be accountability. There has to be honesty about how the market is set up to push people into institutionalized facilities over home care and community care. In fact, between 10 to 20%, in some areas 30% of nursing home residents do not need to be there if we had a better home care and community care system in place. That means being honest about our failure to take care of our home care workers. Like, why are to this day workers being told to work 24-hour shifts and not getting paid overtime? Like, we need to get to the root of these tough issues to fix it, to fix the pipeline of home care, and also invest in preventative care to make sure that we don't put people in institutionalized nursing homes. And the reason why the system pushes people in institutionalized nursing homes, for every nursing home resident, the facilities make about $230,000 per resident. For home care, it ranges between $9,000 to $30,000 a year of Meals on Wheels and various other programs. So simply put, more people make money when older people are institutionalized, and that money influences politicians to write bad policies and to write executive orders, like giving get out of jail free cards in the middle of a pandemic, or the current governor giving a moratorium on a bill that we fought so hard for safe staffing and direct care. And that needs to stop.
And a couple quick follow-ups for you as some members, since you've been really active on this front. I know you stood up to the Cuomo administration early on and got some attention for that. How would you say the Hochul administration is doing? You talked about that moratorium you're not really happy about, but also, again, going back to this long-term care ombudsman program, the governor says they're bolstering it. It seems like what they're really proposing is a study at this point. Do you think more needs to be done? Do you think they are hearing that they would could get behind adding more dollars to that program?
They should have led with $20 million and not with the study report. Like they know exactly what they're doing. They are still controlled by the same lobbyists who are on the side of nursing homes and hospitals. What about the families? What about home care? The agencies that do preventative work are still undermined in this budget. Instead of strengthening those budget numbers, they're still giving away billions of dollars in the form of bonuses that is untrackable, which is really just a payout for the institutions. It's not going to wages, it's not going to the workers. This is an unserious budget, in my opinion, in terms of how we're dealing with this crisis, and she needs to do better.
And then lastly, you've also, I believe, pushed for a victims compensation fund for families of those who died in nursing homes. What's the latest on that front?
The new commissioner, I think, has taken us a couple of steps back, thanks in part to some of the tough questions by the senator and others. She's unwilling to even admit that even the slightest mistakes were made under the previous administration. She's not willing to go back and investigate. So without a clear line of fault, it's hard to establish a victims compensation fund. So that's why I think we need to start with the independent investigation, a full audit, and not a whitewash report by the Department of Health that absolves them for anything. How could you say you sent 9,000 COVID patients to nursing homes and that didn't have an impact in the industry? I mean, that is a lie, and that's why we need a full audit to have accountability and then establish a compensation fund for the families.
Thank you. And then we have two more lawmakers. Thank you for your patience. Assemblymember Karines Reyes, over to you.
Thank you, John. And I want to thank all my colleagues for being here. I want to register my support for the Ombudsman program. I think they are our eyes and ears in our healthcare facilities, particularly our long-term care facilities, and professionalizing that agency is super important, and we're giving them the resources and the tools that they need to actually do the job that we expect of the Ombudsman program. But I also have to say, I have a little different perspective when it comes to the nursing home situation during COVID, because I was a frontline worker, and many of us were asked to do things that we would have never done any other way, under any other circumstance. And this is not something that is unique to New York City or New York State. This happened across the country and across the globe. So we have to be very careful when we think about that. But I think what this crisis has done, what the pandemic has done, is really helped us shine a light on long-term, long-standing issues in our healthcare facilities. The reality is that what brought COVID into nursing homes were the workers. And the reason why this was such a problem is because most nursing home employees, particularly ancillary staff, have 2 and 3 jobs in different healthcare facilities. And they're the ones that, had to care for 50 patients at a time. The patients weren't moving from room to room to room. The healthcare workers were. And that's because we have been providing them with sufficient staff, with sufficient resources to do the job. This is a long-standing issue that it is going to be the demise of our healthcare industry, and it puts the life of our elderly and our most vulnerable at risk. And I have to thank my colleagues for really taking the staffing issue seriously. And it's something that I'm going to continue to beat the drum on, because that ultimately is what's going to fix this problem.
And a quick follow-up, we heard a couple mentions of the safe staffing bill and the moratorium on that. I know, the nurses union has fought really hard for that, and you're a nurse yourself. Can you elaborate on what the status is there? And I don't even know when the timeline might be for that to go into effect?
From what I understand, that there are facilities that are currently challenging in court the staffing bill, because facilities are saying that they can't afford to pay. And I think as a state, we need to really make an investment, not just in long-term care, but also in the pay of healthcare workers, particularly those that work in nursing homes and those that work in home care, because the ideal scenario for our aging population is to keep them in place, keep them at home in the communities that they know. And we should be making that investment. And we make that investment by ensuring that the people who work in that industry have a living wage and are able to continue to do that work. And that's why we're fighting so hard to make sure that we include that in our budget, and that fair pay for home care is a reality this year.
All right, we'll get to that in a second, but finally, Assemblymember Al Taylor, thank you for your patience. Over to you. I can't hear you, Assemblymember.
I was so ready to go. I forgot to turn on my mic. I'm so excited here. Listen, thank you all so much. Thank you, John. Thank you, Chairman Kim, and my colleagues for being here this morning. I'm only going to repeat or paraphrase most of what I've heard. But what I would say is we have a responsibility to take care of our future. I'm talking about our future. Lord willing, we will all get old, and we're going to need some care. The question is, what kind of care? Where? And I think the chairman said it earlier, this wasn't something that happened in the pandemic per se. It shouldn't have taken a tragedy of this magnitude to get us to look, right? I mean, I can flip a burger and make more money than I can do home care. We have an aging, my dad, he's 83. So he needs 24-hour care. And the last place I wanted him to be was in a nursing home, because prior to this, you could see that people were overworked and understaffed already. So what would happen? I mean, this is not a surprise. It was an accident or a tragedy waiting to unfold, but it should not have taken that many lives for people to stay. We need to do something about this. I commend my colleagues in the legislation that they proposed. I support the ombudsman. I would say let's incentivize them so they want to do the job. And let's put people instead of money. And I think we can turn this thing around, but it's not going to happen overnight. It's not going to happen. Why is someone working 4 jobs? Because they're trying to make one income. I remember as a young person, I'm not as young as I used to be, I had 4 jobs working for the state, working for my legislator. I had 4 jobs. In any given day, I would work 3 because I needed to provide for my family. And when you put people at risk like that, you're saying, 1, you don't value them. 2, they're doing all they know how to do. And then you have a system that says, we want you there 24 hours a day. It's impossible. So I commend my colleagues and thank you all for hosting this AARP. We need to do better, and I look forward to working.
Great, thank you. Bill Ferris at AARP, over to you.
Thank you, John. It's great to be part of a panel with elected officials when you don't disagree with anyone. So this is will be a good conversation. From AARP's perspective on the nursing homes and the work that the legislature did last year with the safe staffing, which was really driven by the Nurses Association and some other home care or healthcare worker unions, and the direct care pay that nursing homes have to do. It was very disappointing that the governor put a moratorium on that. A lot of people worked hard on that. The nursing homes and what happened in nursing homes was a tragedy. In AARP's opinion, I believe over 15,000 people died in nursing homes. So that was much needed legislation that I believe everyone on this call today was supportive of. So we would definitely like to see that be implemented sooner than later. And it is disappointing that the nursing home industry is suing on that issue. But as far as the long-term care ombudsman program, this program is in need of help. It's underfunded, understaffed. AARP was, we were a little disappointed. We saw in the governor's executive budget, her policy book, that she believes that there should be a study of this program. And it was disappointing because the comptroller in New York, the comptroller in the city, both came to the same conclusion after they audited the program, that there isn't enough staff and it's underfunded. And I think someone said today that there's not enough ombudsmen to visit facilities. I think the number is up is 40%. They can only reach 40% of the facilities. We have 1,500 facilities in the state of New York that I believe 900 of these facilities don't even have an ombudsman going to their facility. And they are the eyes and ears for the residents, and they communicate with the family caregivers. And that during the pandemic was sorely needed, a communication between what was going on in the nursing home to families and family caregivers. And we think that the $20 million investment is well worth it, both for the people and the most frailest of our population here in New York. So we think it's a wise investment, and we really hope to see the one houses that come out soon will make that investment, and it will become part of the final budget.
Great, thank you, Bill. We are already almost halfway through the time, so we'll try to speed things up a little bit here. Let's pick up the matter of pay levels for home care workers, an issue that already came up. Some advocates are pushing for the fair pay for home care measure, which would raise hourly pay for these workers, I believe, up to $22.50. From as low as $12 in some parts of the state, and that may involve higher Medicaid reimbursement rates. Unfortunately, Senator May could not join the panel. She's a sponsor of this measure. She's sick today. But would any of you like to weigh in on that measure? What's the likelihood of it happening? Is it getting traction? What are we hearing from the governor's office? Maybe Assemblymember Kim, start with you.
Yeah. I think all of us here agree that we need fair pay. So I think that we've been saying it consistently. We've been advocating for, we've been rallying around it, but the executive is not taking this issue seriously. And I'm very disappointed in this because we know for a fact that the previous governor, going back to when he was AG, has always undermined the home care sector and favored the institutionalized sector. So we want a change immediately. And then part of the problem that this bill does brilliantly is that it addresses the intermediaries that are often the gray area of how they reimburse, the MLTCs, the managed care, that under the guise of cost effectiveness have cut corners for years in terms of how they reimburse for care. But this bill addresses that. But furthermore, moving forward, I think we need to really have more direct conversations about how to fix the managed care system that is by design a for-profit intermediary. So imagine having a for-profit intermediary that handles reimbursements, and they're driven by profits. So they undermine care and try to extract as much profits in the middle as possible. Other models that some of my colleagues oversee in the Office of Aging, we have non-Medicaid home care work that are getting paid livable wages because we still have direct county assessment of an older fee-for-service model where we're giving rates directly to county. The counties are not tied to Medicaid, and they're able to negotiate much higher rates, up to $25, $30 an hour even, for some of these workers. So in between those things, I think we need to look at the structural flaw of how we have to rethink and redesign the payment structure of home care, as well as putting more dollars behind it.
Can I add something as well? Can I jump in? I'm sorry, I don't know that. Which is I 100% agree with my colleague on all of this, and am a co-sponsor of the Fair Pay for Home Care workers. But the other side of this is the entire care community. We were just talking with some of our home care workers yesterday who had to quit because of childcare issues, because she works nights and weekends and there's no availability. And that's one of the reasons our providers don't get a higher rate for providing care in evenings and weekends. So it just also shows how this entire continuum of the care economy is so intertwined. And if we have to look at every single piece of this if we're going to say that those who care for those we love are the most important in our economy, more important possibly than, what you might get paid at a fast food place or something like that. So this is all intertwined, not just the wages we pay directly to our care workers in home care, but also childcare and these other factors that influence their lives every day. So it is all intertwined, and we really really have to do a lot to. This year, I think, is the opportunity to really look at it all and decide as a state what we're going to do and what we care about.
Also, could I chime in as well? And I'm going to mention home care, fair pay for home care. I believe everybody on this panel is for that. How can you not be? And if you want to look at it, and Chair Kim did mention this, I mean, this affects everyone, socioeconomic, all levels. I mean, we want to see our loved ones and our family members age in place, and they want that. So we need to invest on the front end of this. And God bless our nursing home workers and the people that put their lives into it. I'm all for that and getting them fair pay as well. But our home care workers have been ignored. They've been ignored for years. And if you want to look at it in an economic stance, it is much cheaper. And I look at it as with a human eye on it, but it is much cheaper to invest in the front end of this than the back end of this as well. Keeping our loved ones and our neighbors age in place. Also transportation. I may be in a little more unique situation than some of our other members. Transportation, but I think we all fall into this. Transportation costs for our home care workers is not often into that. I have a bill out, Medicaid reimbursement bill for transportation, which allows transportation costs to be factored into that as well. We need that. Assemblymember Clark talked about childcare, but we have to professionalize, and the home care workers that do it are great. They really are. They come into our homes, come into our loved ones. They do a great job. We need to professionalize this more and pay them the wages that they need and invest in them. We need to do it. It's the right thing to do. We want to see our loved ones and our neighbors age in place, and they want that as well.
Can I jump in there? John, I think my colleagues are hitting it spot on. And after the budget is passed, there's something going to happen in June, and then there'll be the shuffle. But I would urge your audience and your constituents to go full blast on this before we finish what we have to do to see if we can get a shift. Because if not now, when? We're going to have this conversation 4 years from now. I was speaking to some folks, and they had done some statistics. And typically, the average home caregiver will only go about 10 miles outside of their home space because of transportation and issues. In addition to the fact that they're not getting a fair wage, but I'm not going 3 hours somewhere and it's going to take me 2 hours to get there. So I think Billy said that we have to look at professionalizing this, but also I would say and urge your audience to hey, push in on us and the governor and everybody else to make sure that we're putting real things on the table for them and not just saying, yeah, we agree and we're going to do it. And it's not going to happen. We need some deliverables, and they're the people that can make it happen, with all honesty. I have something that's called good trouble. Let's get some good trouble.
Well, my understanding, we'll go to you in a second, Senator. The governor, I believe, has proposed a one-shot bonus, kind of a one-time thing, not sort of a long-term. Is that a good first step? Is that promising? And then broadly, anything else you want to hit on? Senator Serino, over to you.
Yes, thank you so much. Bonuses are not a long-term fix. People have to have, in order to live, you need to know what your budget is, right? So that's just something that's going to help them maybe get caught up with the bill, and then they're right back to the drawing board again. We really, need to make sure that we are increasing these funds. That's why the home care, the fair pay for home care is so important. But it was really interesting at the health hearing, hearing the Home Care Association about legislation that would be a transformative plan for them. So I'm really looking forward to delving into that this next week. But it's also encouraging everybody here on this panel. It doesn't matter what side of the aisle we're on. Our parents, loved ones don't have an R or a D attached to them. This is a real crisis that we are facing. And when you talk about short staffing, I've been on that bill for years, but we don't have the staff, right, to even hire. So we need to do things to incentivize them. And transportation's an issue. I was a single mom. I remember the childcare that the assembly member brought up was a huge issue. I actually opened up a daycare just so I could stay home with my child. What do you do? And then Assemblymember Reyes, you really hit the nail on the head too. Having skin in the game with you doing the job, so you really get it. Like there are some wonderful home care facilities. I had people talk to me just this week about wanting tax credits for home care, but also about the respite for like day programs, the social day programs. Like if you have family members, for the past month and a half, I've been taking care of both my mom and my mother-in-law. So somebody who I was chair of aging, now I'm ranker, right? You think you have all the answers. And I can tell you, it's been so difficult. We need to simplify the system, but taking care of both of them and finding workers, it's hard. I don't know how the regular everyday person does it. So there's a lot of work that we need to do.
Sure. One thing the Home Care Association of New York State has said, they argue that they say that Medicaid rates would have to be hiked to compensate providers enough. And they note that Medicare is not controlled by the states. Does anyone have an understanding, I'm getting in the weeds here a little bit here, but like how this would actually be funded? Where would the money come from? Would the federal government have to be involved? Is it just state dollars that could be put towards better compensating home care workers?
Well, John, I believe it's going to be, a lot of it will come from the Medicaid program, which is shared by the federal government and the state government. But to the point about fair home pay from AARP's perspective, and Beth knows this well, anytime AARP talks to our membership, either through a survey or town halls or teletown halls, the same thing comes back constantly when long-term care comes up. And it's our members want to stay in their home as long as possible. I mean, that is hands down the answer that always comes back. They want to stay in their home as long as possible. If they need care, they want care brought in. They prefer a family member, but then if they can't have a family member, they want a professionally trained staff person to come in and provide that care. And that's where AARP arrives at fair home pay. I mean, we talk to advocates all over the state, literally every week. We talk to the sponsors of the bill, and it is said that we have the largest shortage in the country when it comes to home care workers. And we know the population is getting older, and it doesn't make sense that a final budget would not contain a provision and an allocation of funding to really make an investment in our home care workers. It just does not make any sense not to do that. I mean, the comptroller came out with a report, I believe a day ago, that says New York is in the best financial shape it's been in this year and the out years, as they say. So in AARP's opinion, the time is now. If not now, the question is when. And so we believe it needs to be done now. We did a survey, and our members don't want to go to nursing homes. COVID, everyone read the newspapers, everyone watched TV. They do not want to go to nursing homes. They didn't want to go to nursing homes pre-COVID. Now they don't want to go to nursing homes at all. So how do we keep people at home? We have to make an investment. And the other hand is, when you make that investment in home care, especially for the workers who our understanding is half the workforce is right around the poverty level in New York, which, that could be a whole nother discussion of how that happened. But we just need to make that investment. It has to be made, and it would be very disappointing, not only to AARP, but I think a lot of people in the state if that investment wasn't made.
Sure. And that's a good segue to another measure, the family caregiver tax credit. But before I get there, do any of the other lawmakers want to weigh in on the fair pay for home care measure?
Yeah,
sorry, go ahead.
I'm sorry, really. I just wanted
Go
to
ahead.
add, I understand that the funding for fair pay for home care would come from our Medicaid share. And part of that was asked of the Medicaid director during the health hearing. And his answer about the bonuses was that that they believe it would be diminutive, that it wouldn't really get to the workers. And what we offered was that we are willing and always open to look at a solution to make sure that however their pay scale is or their fees are being calculated, that we are willing to legislate that. But and they have to have a conversation with us. So I believe that the legislature in general is just open to trying to find a solution to the problem. And we believe across the board that bonuses are not the answer. The reality is that there's also a fiscal cliff for many of these workers. The reality is that most home care workers are women, and they're women of color. And this is really an equity issue. And we need to think about, because they're paid so low, many of them are on other types of financial assistance, that a bonus might disqualify them from receiving those benefits. And the reality is that we need to think long-term about how they're getting reimbursed for the very important work that they do.
Member Jones, you had a quick point?
Karines stole my thunder there. And I actually was going to talk about how the bonus will actually, I mean, everybody wants a bonus, but it will hurt some of our home care workers, because it'll actually kick them off from SNAP benefits that they may be getting, which is sad to say that many or some of our home care workers are actually subsidized through other benefits. They need to be, because we pay them so low, which is ridiculous. And I just want to bring in a point about, obviously we need better Medicaid reimbursement. I have a bill in on that for other factors in this, but the people that are on that cliff as well, that aren't eligible for Medicaid benefits, that our OFAs have to step in with a variety of funding through state and federal and different organizations funding too. We must recognize them as well and reimburse them at a better rate as well, but we need to put money into it. And I will say this again, the goal here is to have our loved ones and our neighbors age in place in their homes. Mr. Ferris said that that's what they want. We know that that's what they want, but we need to make that investment, because it covers everyone, not only people that are Medicaid eligible, but people are just above that, not wealthy by any means, but are just above that. We need to invest more money into getting to our organizations that help our OFAs out, getting that unmet needs. I think we've done a great job on that in the last couple of years. I want to thank the chair on that money, but we need to invest more money on that to get people off those lists and get the care that they need as well.
All right, we'll jump into the family caregiver tax credit. This is something that's been debated at the federal level. There's also a bill sponsored by Senator May and Assemblymember Kim that would create a state caregiver tax credit for unpaid family caregivers. I believe it'd be up to $3,500 for individuals who make up to $75,000. Assemblymember Kim, could you talk a little bit about what that bill would do and what kind of support it's getting?
Yeah, there's so much to the care economy that goes unvalued and devalued every single day. And what this does is recognize the attention and the work that's required to keep people aging at home. We're talking about transportation, small fixes, setting up their homes correctly. All these expenses add up, and this bill will allow a tax credit at the end of the year to up to $3,500 for those expenses, so older adults can comfortably, with dignity, age in their homes. I think it's a great bill that was originally put up by Harry Bronson, the former chair, and I'm proud to push it this year with Senator May, and hopefully we'll get it done. I know the AARP is also very much behind this bill as well.
Great. Anyone else want to weigh in on that measure?
Just to say that from AARP's position, I mean, we're in full support of this bill. We think it's needed. But if you look at what the State Office for Aging has said in the past, and if you look at the literature of who is really the backbone of our long-term care system, it's the caregiver. And they are the front lines of usually family caregivers, usually an adult child who's a woman, the daughter is really providing that care for the older person in their home. So we think this is just another way to support those individuals who keep an older person in their homes with a tax credit. But it just goes back to the other issues with them we've been talking about. There is no real one policy that can help people stay at home. But what's on the table right now in New York State is fair pay for home care. And that's something that is right now in the immediate that can be done. And that actually helps family caregivers as well, because if there's not an individual coming to the house to provide the care, then that care is thrown back on the family, once again. So all these issues are really connected. As I said, there's no one simple solution to this problem in New York. There's several, and they need to be addressed, especially in the financial shape that New York is in now. Investments need to be made.
And I would echo, I think Assemblyman Jones already said this. Again, it sounds like we continue to talk about all this money that's needed, but this is a true cost saver down the road. It's hard to sort of imagine, but keeping more people in their homes, having the right care for them is a better financial decision, or a better financial choice to make than long-term care facilities and other ways that we care for those who are aging. So it sounds like a lot. We keep talking about all this money that's needed, but it really is something in terms of planning for the future of our aging population, and even for the finances of New York State, a better investment.
And I just want to say too, that I support that tax credit is so important. I look at my mom and my mother-in-law, they both want to stay home too. And I think you see that across the board. They're comfortable. It's that this is going to be a combination of the fair pay, also, like I said, the social adult daycare systems, those are really important. The tax credits, it's really a combination of everything that I think we really all need to work on. And it's amazing, like our seniors made our communities what they are today, but yet I feel like they are always an afterthought, and it is so frustrating. And I know everyone on this panel agrees. So we have to do everything that we can to be able to keep them home and in our communities. So, and I want to say a special thank you to Beth and Bill. Thank you so much. This is a great panel, and I really appreciate you guys doing this today.
I'm thinking of something that I've heard Chairman Kim say many, many times when it comes to how we treat home care as a business. And when we put people in these facilities that are making a ton of money, that are supposed to be nonprofits, and they get the tax breaks and they get the investment. And yes, we push them to do the right thing. But there has been a concentration of our efforts around that issue for a very long time. And I think Ron is correct in that many of them are using the need of our families to make money, because whether they're a nonprofit or call themselves a nonprofit, somebody at the top is making millions of dollars out of the need of our community. And so when you have the opportunity to keep people home and give their caretakers, their family members, a tax credit for that, why is it so difficult to actually prioritize that over making sure that that we give them dignity? So we'll give the corporation, because I'm going to call them that, most of them operate that way, a tax break, but we can't give the people who are their family members, like the senator, that same opportunity. It makes no sense that we actually even need to have a bill to do this, because it should have been easy. It should have been a done deal by now.
Sure. Switching gears slightly, we've heard a number of areas where there's feeling that the local administration could do better. However, the governor did just announce a comprehensive master plan for aging, part of her state of the state policy proposals. Includes things like $10 billion in workforce investment in healthcare, long-term care, home care, and human services. Would pursue alternatives to nursing homes by investing in supportive housing, preserving affordable housing, creating a standard definition of memory care, et cetera. Strengthening, as we discussed, the long-term care ombudsman program. What do you make of all this? And more broadly, how is the Hochul administration doing? What kind of proposals really have teeth, really are going to make a difference? And anyone can go first on that one.
Yeah, I go ahead. I'm sorry.
No, go ahead, Assemblyman. Go
ahead. I just think we need more details in how this money will go directly to wages, including back wages of many home care workers that they're owed, and really rebuild the foundation of home care the right way. And secondly, the one thing that didn't come up today, if we do this correctly, you would change the entire spectrum of how we value older adults, which is amending the wrongful death statute of the state of New York. Because right now, the way that it's written, your life is based on economic output and your income. So if you're an older adult in a nursing home, your life is not economically valuable according to New York state law as a younger, more productive human being. Unless that, so when you die of trauma, pain, all the intergenerational knowledge, all the family love that's ingrained in our older adults, it's not properly captured in our law. So unless we give the families and patients and residents more recourse and really strengthen their rights as patients, we're going to see a similar pattern of abuse, because at the end of the day, it doesn't cost that much money for some of these institutions to abuse the residents. Even if they get sued, they can deal with it. So we need to make it very expensive to abuse and to mistreat older adults in the state of New York.
Great, thank you, Mr.
Sure, John, on the master plan for aging, AARP is in full support of that. As we discussed, we have an aging population, and we agree there needs to be a master plan for that. I believe the governor is going to issue an executive order on that, and AARP is participating with really statewide organizations, meeting regularly on advising the governor on that executive order. So we're looking forward to that to come out. As you mentioned, the governor did make a lot of investments in the healthcare system, trying to transform nursing homes in certain ways and in the investments overall for healthcare. But we think that the governor missed the mark when it came to fair home pay. And that's something that we believe the legislature can really, put in their one houses and get that conversation going. But overall, there has been significant investments by the governor in healthcare, and coming through a pandemic and preparing for possibly another pandemic in the future. AARP views that as a positive thing, with the exception of leaving some certain stuff out.
Okay, thanks, Bill. And we just have a few minutes before concluding remarks. Does anyone, maybe one or two of you, have any pressing points you want to make before we run out of time?
One thing I do, we talk a lot about, where people are being cared for and how they want to care. One of the things that I've been really passionate about, and I'm so fortunate in Rochester to have Lifespan, which does a lot around our elder abuse, both in Rochester, but also statewide, and have some really great models. But what they've also piloted over the last few years is what's called the Community Care Connections, which is partnering with primary care physicians who care for our older New Yorkers, and working on sort of the non-medical needs of those, including food access, housing, but also prescription drugs, making sure everything's being taken. And what they used Medicaid dollars to do this and Medicare dollars to do this. And what they showed is by just pairing these various patients or these very resident or community members with a caseworker of sorts and the primary care physician, they not only saved healthcare dollars, but they had better health outcomes. So as we start to look about how we're caring for our older New Yorkers, we look at how they're being cared for in their homes and in long-term care facilities, but also all the other services that are required. And what are we doing? And we can do this better. So let's start building on those things and do this better, center our New Yorkers in the conversation, but even on the medical side of things, we can do it cheaper. Some of the medical issues aren't really medical issues, they're basic needs issues. So we can do this better, and I'm really excited to start building on this and have so many amazing colleagues who are as passionate about caring for our older New Yorkers and seniors. So that's.
And I just mentioned one thing. Oh, I'm sorry, Senator. Just the workforce development is crucial and is critical to all kinds of fields, but we need to take it more serious when it comes to our home care workers and our nursing home workers. Why can't we do something and incentivize partnering up with our community colleges, doing more of that to help with these support services and get and recruit home care workers? We're talking about professionalizing this field, and the ones that are there now are doing great. They're doing God's work, but we need to help our home care agencies recruiting more people, and that is done through workforce development and incentives in doing that. So that's just my point on that as well.
Well, last word to the senator before we do our concluding remarks. Senator.
Thank you. And everybody's brought up some great points. And, lifespan is so critical. I remember years ago, I did a roundtable, and that's how I found out about it. And we were able to expand it. And we really need to make sure that that program is funded. And I just really hope that everybody takes a look at that, the bill that we have for looking back. And so we know, like Assembly Member Reyes, like what happened, like PPE, all of those things that the state should have provided, that's what we will discover in this investigation. And so it's not a matter of if, it's a matter of when something happens again, and we need to be prepared. And I really hope that that does happen. The governor had said when she met with the family members that 50 years from now, we should be able to look back and learn where we went wrong. And that needs to happen. So thank you very much for doing this today.
Great. Thank you, Senator. And thank you to all the lawmakers. We'll now go to closing remarks from Beth Finkel, State Director of AARP New York. Beth?
Thank you. I thank you for the dedication of each and every one of you, because I heard it. I have to tell you, I took notes on everything that you said, and it felt so good to know that you are committed to making life better for older New Yorkers. But I want to go back to what Assemblymember Taylor said, because it will be us one day. And we are building this, for this current generation, but for the growing aging, the next decade, 1 out of every 4 New Yorkers is going to be 60 and older, far, far exceeding the numbers of younger New Yorkers, of children 15 and younger. All the demographics are skewing way over to the older side. If we don't get a grip on it now, we don't figure it out now, then we're all going to be in a lot of trouble, not just us personally, but our family, but our society. So we really do need to support family caregivers. I think we heard Senator Serino about the essentialness of long-term care ombudsman. And we have to figure that out, because you're absolutely right. We have to not just study it, we have to bolster it. And that is so essential. The fact that we are now in the place that we are, California spends 3 times more per nursing home recipient for long-term care. And I think it was Bill who said this. Do you know we're 39th in the country? How can New York be 39th in the country on long-term care ombudsman spending? It's outrageous. I want to go back to what Assemblymember Clark said about oversight and stressing the AG reports. Again, these complaints keep going unanswered, and we agree with you, Assemblymember. We can't have this anymore. And thank you to Assemblymember Cruz, because you talked about prioritizing the needs of long-term care, because these are not just clients, these are not just patients, these are our neighbors, these are our family members, these are our community members. And I just want to go back to thank you so much, Assemblymember Jones, because you talked about workforce development and the transportation pieces, which are equally important. I gotta go to Ron Kim, because he has been a champion for so long on these issues. I'm so appreciative that he's here and has spoken up. And I think his underlying text is about ageism, because we are seeing ageism in every manifestation of this, and we have to confront that. And he's given us a great list of what we have to get done, and we agree with him. But we also have to confront this ageism, which I think that the Master Plan on Aging will do. Okay, and then finally, I want to go to Assemblymember Reyes, because when you talk about fair pay in the budget, without fair pay, we are going to struggle forever, because again, we have the largest workforce shortage in the country, the largest. So I think I just want to thank each and every one of you. Again, I think AARP's priorities came out loud and clear. 20 million for long-term care ombudsman. We don't need to study it anymore. We have studied it from here to eternity. We need to just take care of it now. Fair pay for home care. We need to make sure that enough money is going into home and community-based services into the county, so we don't have to confront waiting lists. And we need to make sure that we're all standing up for older adults in this state. We need to show it. So I thank you all for your commitment, and I thank City and State for putting this on.
Thank you. I'll just note quickly, we have several more of these discussions in coming weeks. The next one is on Friday, February 18th, the same time on drug prices. So if you like this, please tune in for that discussion as well. We'll have some more after that. Thanks to AARP New York, thanks to our panelists, and thanks to our audience for tuning in. That concludes our program.